Hey guys, I'm Dr. Andy. Today I want to go over probably like the number one question that I get in my office, especially as we tailor towards the end of a treatment plan. We're starting to feel a whole lot better. I always have to take some time to explain the difference between active care and then maintenance care and what that kind of looks like and why. Because the big part of it is possibly who is paying for that care. Okay, so that is why we want to go into this, because it can be super confusing. So I kind of want to, hit some of the touch points, some of the big concepts. That way, if you have any confusion, like hopefully this will kind of like put that to rest, okay? But obviously, if you have any more questions, just, reach out to me, ask me, I can do my best to explain the differences, because obviously insurance and things like that can be quite confusing, okay? So today I want to go over the differences between active care and then maintenance care. There are some kind of big hallmarks to it, okay? First of all, for active care, it's related to a new injury, or it could be actually like a flare-up of an old injury. But really kind of what I mean by is like you've been kind of plugging along, and either you have something brand new, meaning that you've never had neck pain before, and suddenly you've done something and now you have neck pain, right? Or, you were, playing soccer and, you twisted your knee or something like that, and boom, now we have knee pain. That is a new injury, right? Or you could have a flare-up of an old injury. And what that means is that you've had low back pain for 20 years, but, it usually hangs out at like a 2 out of 10 pain level. You were moving some stuff at the house, and the back pain as a result skyrocketed. It's now a 6 or 7 out of 10. It's a lot worse than it was before, all right? It's a lot worse than what it normally is. That is what we call a flare-up of a chronic injury, okay? So when we start to treat that, that is still considered active care, okay? But there's a couple more hallmarks to that, all right? First one, our big goal, and what are we trying to do? We're trying to reduce pain and restore function. Because of that knee pain, because of that low back pain, you can't squat, you can't play with your kids, there's something you can't do, excuse me, so we are trying to restore that function, and we are trying to reduce that pain and make you feel a whole lot better, okay? Also, at that point, we're very multimodal, right, in terms of our approach to your care. We're going to be throwing things at you like laser, shockwave, spinal manipulation with the adjustments, some soft tissue, a lot of rehab. We're going to be doing a lot of things because they work synergistically, meaning the more that you do, you get an even better result with the core principle of like number 2, we're trying to get that pain level down. So the more we can do to kind of get that pain level down, the better and faster that you are going to get better, okay? Secondly, or the next, is this is a big part of it. So, in terms of how we look at things, or in terms of like, are we able to file to insurance companies or not? Is this a covered service? Is the big ones is it a new injury, right? When did this start? And then a treatment plan. And what I mean by that is that insurance companies, and when you're under active care, what they're expecting to see is you to start care. You've had this new injury, and boom, this is when your care in this office begins, even if it's a flare-up, right? But then there needs to be a documented plan of, I'm going to see you 3 times a week, twice a week, once a week, over the next 2, 3, 4 weeks, with a scheduled re-exam, and then an idea of like, what are we going to do after that, all right? So that's what they are looking for in terms of what is considered active care, that there is a treatment plan written in place, that this is what we expect to do over the next couple of weeks. And it's not like, I'm going to treat you once and that's the care plan, right? That's not really active care. They're looking at, there is some kind of frequency of care there, because we are trying to get that pain level down, okay? With the general idea is that we are trying to get you well now. Get you feeling better right now. One of my friends actually describes it as like getting you, if you fall, the idea of active care is getting you up off of the floor. Maintenance care is keeping you standing, okay? So hallmarks of active care is it's a new injury, recent, or it's a flare-up of an old injury, right? Everything that we're doing is designed around restoring function and getting you feeling better. We're multimodal in approach. We're doing a lot of different things. We have an active treatment plan that we have written out, that we've talked about in terms of, I want to see you X amount of times per week over the next couple of weeks. And the entire idea is getting you up off the floor, getting you well now, all right? That's different than how maintenance care looks. Maintenance care, supportive care, preventative care, There's a total, there's a bunch of different names for it, and it all has to do with like what are your goals, okay? But there are some kind of things that when you look at all of those different types of, whatever you want to name it, have some things in common, okay? And what are those? The biggest one, and how we might describe it, is like a tune-up, right? If I see you once every other week, once a month, once every 3 weeks, or 3 months, or once every 6 months, we notice that when you're in here, maybe the pain is a little bit worse than the last time I saw you, right? If the last time I saw you and I discharged and you're at a 1 out of 10, well, maybe it's increased to a 3 out of 10, but really we're just seeing you this one time as a tune-up, like we do with our cars, to get you back down to that 1 out of 10, and you're good to go for the next, 6 weeks, 8 weeks, or, once a month is usually the most common, right? So it is like a little tune-up. Our idea is that we're trying to minimize that pain, meaning if it creeps up to a 2 or a 3, we're getting it back down to that 1, we're minimizing it, or we are preventing it from getting a whole lot worse, okay? As opposed to everything's designed around, taking your pain from a 6, 7, 8 down to that 1, okay? We don't do too much rehab. It's not a lot of multimodal, kind of things going on. You don't need as much, right? Because the pain is a lot lower. I don't need to throw the kitchen sink at you, okay? So we're gonna do some soft tissue. I might teach you and, extract, maybe send you a stretch that you can do at home, but mostly it's relying on like spinal manipulation if that's what you need, okay? A hallmark of it is it's like routine, right? Instead of having a treatment plan, I wanna see you twice a week for the next 4 weeks or once a week for the next 4 weeks, it's routine in that it's like, I'll see you every other week, I'll see you once a month, I'll see you every quarter, sort of indefinitely, meaning that, it stops whenever you want to stop or you don't need it anymore, don't want it anymore, right? But there's no written plan of this is exactly when it ends. It's sort of like every month I might see you and there's no end date unless you want there to be, okay? The idea here, as I just said, if active care is getting you up off the floor, this is to help you stay standing, right? This is so that you stay well and that you are able to function at 100% all the time. Because what happens is that when you first come in and you're over here, you've lost function, you're not feeling so great, like life's not awesome right now. You know that there's some things that have kind of been taken away from you by that pain. And then we get to restore that, and that's really exciting, getting you to feel a whole lot better. And then you get to the end of that and you're like, well, what do I do so that I can maintain this? What do I do so that I can feel 100% all of the time? And that's when we tell you that maintenance care is available to you. Okay, so I hope this sort of explains the differences, and these are the hallmarks between active care and maintenance care. There is some other nuance to it, so if you have any questions, obviously just ask. But hopefully this explains some of it. So as I said, if you have any questions, send them my way, and always remember to live with passion, not pain.